Nobody wants to lose a loved one, friend, family member, or anybody, for that matter, due to somebody's lack of knowledge. Hi, I'm Hannah Hicks, and today I will be discussing the importance of cardiopulmonary resuscitation, also commonly known as CPR. CPR is the manual pumping of the heart after cardiac arrest. Now, my experience with CPR is that I've taken 4 years worth of health classes and 1 semester of clinical rotations, which required me to know CPR before I was even allowed inside the hospital. So first off, what is CPR? CPR is the emergency life-saving technique that is used to restart the heart after cardiac arrest, according to the American Heart Association. CPR uses chest compressions to pump the blood through the body because the heart cannot pump itself and pump that blood all by itself. So you have to manually pump that blood. It also uses mouth-to-mouth breathing. This introduces oxygen into the bloodstream, which is vital for blood cells to continue to live. Now, there are 2 common types of CPR. The first type is conventional CPR. This is used by healthcare professionals in healthcare settings. This uses chest compressions and mouth breathing ratios, and this is used in usually 30-2 ratios. The second type of CPR is hands-only CPR. This is used in bystander situations, when passing somebody on the street who has collapsed due to cardiac arrest, or just in any other typical setting. So why is it important to know how to do CPR? Well, in emergency situations and you're with somebody who collapses, you would know how to help them until help arrives, or just in medical situations. So the steps that are taught by the American Red Cross are simple. Before you even consider starting CPR, the first step is to check the scene to make sure it's safe and that nobody's in danger. The second step is call 911. The third step is to open the airway, and you do this by tilting the person's head back. And the fourth step is to check for breathing. Now, when you start CPR, the first step is to push hard and fast in the center of the chest. The second step is rescue breaths. And the third step is to continue until help arrives. Generally, the rule is 100 beats per minute, and you can keep track of this by singing the song Staying Alive. So why is it important, and how could this save somebody's life? Well, in medical and clinical settings, somebody could easily fall into cardiac arrest at a hospital or in clinics. Here, medical professionals have all the resources to help them. Or this could help in your personal life. One of your family members could be at home and collapse, and you would know how to help them. The CDC states that cardiac arrest happens most often at home. So with this, you could save a family member's life. This graph shows how quick CPR began after cardiac arrest. So the quicker you can get to somebody after they've fallen into cardiac arrest, the greater chance they have of survival. In conclusion, it is important for everybody to know CPR. And why is it important to know CPR? It's simple to learn CPR, and you can get certified at a local Red Cross or just anywhere. But it's important for everyone to know how to save somebody else's life. Thank you for your time.